so today we're going to show you how to transport with the H cylinder. Several things you need to know to keep yourself safe, because if this falls on the ground and breaks off, the stem breaks off for whatever reason, we'll get to that in a second, it can be a missile. And if you haven't seen it, look on YouTube, because it's very scary and it does happen if you're not careful. So first of all, the H cylinders or any tank should always be kept in a room upright with a chain around it like so, or on one of these little carriers for you to move it around until you're ready to use it. Whenever you guys get ready to do your check off, make sure that you wear closed-toed shoes, and when you're practicing, because this tank, if you don't already know, is very heavy and it can hurt you if you aren't careful. So first things first, I'm going to talk about the tank. So the tank is made out of steel. There's all kinds of little numbers and stuff on it that talks about like atmospheric pressures and like shows you how much like goes through hydrostatic testing, and you'll learn about that in your your outlines and things like that in your class. But if you actually come in here and play with it, you can see where it's been checked off that it's safe to be used in the hospital and or in the clinical setting. This is your safety cap. This cap needs to be on your tank at all times when it's not in use. This is going to protect the stem of the actual tank from breaking off and turning into a missile. So let me show you guys, this is the dolly that you're going to use, and it's got to be chained up at all times. We can get in a lot of trouble if it's not secure, so please make sure that if you're using it in here or in a hospital that you have it chained up either on a wall or on a dolly as you're moving it. I'm going to go ahead and show you guys the stem of the oxygen tank, and then I'll show you guys how to take the oxygen tank off and put it back on, so that way you guys know the proper technique. So you're going to turn your cap and take it off. You can place it somewhere. When you guys are practicing, you don't have to screw it all the way down to where it's so tight that somebody else can't do it. Be mindful of that, because other people can't get it off and then they can't practice. But this is your tank cap. So I'm gonna place it over here. This is the stem of your H cylinder. So as you can see, it's got ribbing here that fits your ass system for your regulator. And we want to make sure that this does not get hit, because it's super fragile and it can explode. I know I keep saying that, but it can. Look it up on YouTube. I promise. It is scary. So this is your what your tank will look like, and like I said, this is what your your big ass system for your H cylinder will look like. All your regulators are going to be a little bit different depending on the manufacturer, but like here's going to have your flow meter. It has a built-in flow meter for your oxygen device, nasal cannula, simple mask, whatnot. And then this is going to be your PSI gauge. It's going to show you how much pressure or how much PSI of the gas that you're using is in the tank. And I'll show you guys how to hook that up in a second. While we're talking about this, besides this being the ass system due to the threading, this is also a board-on gauge. You have a board-on gauge and a Thorpe tube. Your board-on gauge is going to be used for your E cylinder and your H cylinders. They are not gravity dependent, so you can lay your E cylinders or your smaller cylinders in the bed with the patient if you needed to. You don't have to worry about them not getting their flow or their pressure, because it's not gravity dependent. Whereas the Thorpe tube or your flow meter is gravity dependent. It only works by being upright. So we'll show you guys that later. All right. So I'm going to show you guys how to take this off properly and put it back on, because it's super important and it will be part of your check off. So I'm just going to screw this on real quick so we don't have any issues. If I can get it to work. What you're going to do is you always hold, first of all, you're always going to push with your dolly in the cylinder. You never pull it behind you, because it can get caught on something and it can fall. So always have a hand on it at all times, and always have a hand on your dolly as you're pushing and guiding it through the hospital. Now, when you go to take it off, so in some cases, these cylinders may be on a wall chained up, and you may have to transport it over to a dolly to make sure, to get it where you need it to go, to the patient's room or whatever. So what you're going to do is you're going to hold on to it, and you're going to lift up keep a good hand on it. And then you're going to take the chain off. And then what you're going to do is you're going to twist it back and forth and get it off the dolly. Now, the dolly will fall back and it will be a little loud. That's totally normal. But you want to make sure that you're always holding it at all times. So you're going to twist it back and forth till you get it off the dolly, like so. Okay? Now, when you're going to put it back on, you're going to take your dolly and get it as close as you can to the tank. And then you're going to twist it back and forth until you get it back on. It looks easy, it's not. And it's really heavy and it's kind of cumbersome, but if you guys practice, you'll get the hang of it. So now we're secure. Always have a hand on it and you can move it where you need to go. Now, say you're going to a patient's room. Before you go to the patient's room, you want to make sure that I'm going to leave the tank on the dolly for the remainder of this video, just so that we don't have to take it off and put it back on, since you guys already know how to do it, because I just showed you. So you're going to take your cap off. Always place your cap to the side, like I said before. Okay. Now, before you get ready to go into the patient's room, you want to gather some things. You want to gather your board-on gauge, and you also want to gather your wrench. You have to have your wrench in order to make sure that you have a nice tight fit on your regulator on your tank. If not, you'll have a leak and you'll be bleeding out a lot of your oxygen, and that's a waste. So I'll show you guys how to do that in a second. Before that, you want to make sure that you crack the tank to clear any debris that comes out of this ass system. Sometimes as tanks are left in rooms, dust can settle in them. If there's any kind of metal shards or anything, you want to make sure that gets cleared out before you put it on the regulator, because the regulator can pop off, it can hurt somebody, or it can blow out and it can like cut someone or whatever. So please make sure that you always crack the tank before you put your regulator on. It's also decompressing a little bit of that pressure. So this is gonna be the funny part, because you guys are gonna be nervous doing this. It's very, very loud. And when you guys do crack the tank, I want you to say crack the tank, and I want you to say it loudly. If we can't hear you, you're not getting checked off on it. So be loud. Make sure that your ass system is not facing anyone. So you wanna make sure that you have it away for no one sitting in front of you, beside you, or whatever. Don't have your hand in front of it when you go to turn it on, because your hand's gonna get whatever's coming out of here. So make sure that your hands stay clear and this stays away from the patient or person or whoever. So, all right, are we ready? All right, crack in the tank. All right, so your crack is done. It's been purged. Any debris that was in here is done. I know, really loud, and that's the part that everybody hates doing, but I promise it's super important, you have to do it. So that's done. Now you're gonna put your regulator on. So you're gonna screw your regulator on, try to thread it. This is always the fun part. So you'll be able to thread it on for as much as you can by yourself, but then you'll need your wrench to get a good, nice, tight fit. Also keep in mind, if you can, try not to, put it on so tight that the other person can't get it off or can't get it on. All right, so now I'm gonna show you what it sounds like with a leak. That's a leak. We definitely don't want that. So you're gonna take your wrench, and you'll have to find your little part, and you're going to fit it in, and you're gonna tighten it to make sure you don't have a leak. Let's see. Yeah, I still have a leak. Still got a little one. Now, some of these regulators, when you guys practice, do have a little bit of a leak on them. They may not be fitting properly, or they're just old, so just be mindful. You may have to switch out a regulator. This is the only one I could find that will fit on this tank. It's probably the best I'm gonna be able to do. All right. We have a little bit of a leak, but we'll be able to show you guys what we're doing. Okay. So as you can see here, we have a PSI. You should be able to read it. It's about 1600, we'll just say for PSI purposes. You see the 1500 here? It's a little bit past the 1500, so we'll say 1500. Just make it easy. Easy 1500. Keep that in mind, so whenever you guys get ready to do your calculation, which we'll get to that in a few minutes, you'll know what your PSI is. So we'll just put this over here to the side, just so I don't forget. All right. Now, for those of you that don't know, this is a Christmas tree, also known as a nipple adapter. The proper term is an O2 nipple adapter. We always call them Christmas trees. They're mostly green, like a Christmas tree. Everybody throughout the hospital knows what a Christmas tree is, so if you call out for one, they're going to know that over a nipple adapter. So, Christmas tree. It hooks up here on your flow meters. My hands want to work there. Hooks up on your flow meter so you can hook up whatever oxygen device you want to hook up to. Now, some people do things a little differently. This is your regulator that you're going to turn on. It's going to give you your liter flow, as you'll see here in a second. Maybe not. There. This is going to tell you how many liters per minute that you're setting your oxygen device on. So right now we're at about 4 liters per minute. There's a couple of ways of purging. I'm going to show you guys how to purge it to make sure that it's safe enough to take your flow meter off or your regulator off. So you got it hooked up. You're going to the patient's room. You're going to hook them up on whatever oxygen device they're on. And then when you're getting ready to take them back to their room, put them on whatever oxygen device they were on, you're going to take this out of the room and you're going to purge the regulator to make sure that there's no more, it's not pressurized in here anymore, so it doesn't pop off or doesn't hurt anybody. So how you do that, there's a couple ways. Some people, what I usually do is I leave the flow meter on, so when you go and turn the tank off, you watch the pressure gauge drop. Some people will turn the flow off and they'll just turn it off and they'll watch for it to go down. It doesn't really matter. There's no wrong way, but I find this is an easier way for you guys to know how to do it, and it's quicker. So leave your flow meter on at 4 liters per minute, and then you're going to turn your tank off. Should go down. I always get my lefty loosey. Righty tighty. Okay, so you see your pressure's going down, and then your liter flow goes down. So we're at 0, and we're at 0 on our flow meter. So that lets us know that it's safe to take this off because we have purged the regulator. Okay. So what you're going to do is you're going to take your regulator off with your tank key or wrench. Oh, it's the part that I hate. So you'll take your regulator off, you'll put it away, put your cap back on safely, but not too tight so people can't get it off. Alright, and then you're going to push, not pull, and go place this safely in the oxygen room. And that's it for your H cylinder.